Welcome back to BNC Live. We're turning now to a growing crisis in the Black community. Ian Alexander, he's the health, right? I want to bring in our panel of experts to help us discuss this alarming trend, rising rates of suicide in our community. Joining me now, we have mental health expert Andrea Wise-Brown. Andrea has consulted multiple schools, police departments to introduce mental health measures in their organizations. We're also joined by the newbie on the block. We have Dr. Cyrus. She's an assistant professor of psychiatry and a Johns Hopkins Medicine Board member. Thank you both for joining us. Andrea, we'll start with you. A study by Kaiser Health found that among teens and young adults, suicide deaths had increased more than 45% for Black Americans, 40% for Asian Americans. Why are Black people? Are we suffering in silence? And why are we dying at such an alarming rate to suicide?
Yeah, it's because Black people hope, and a lot of times, and this is every Black
All right,
person,
Andrea, we're
right?
having
So I
some
don't want to
issue.
judge.
Andrea, your audio wasn't coming in clear. We're going to have someone address that, and we're going to go to our other expert on the panel. Can you answer that question for me, Dr. Cyrus?
Well, I think it's a complicated question, but as far as we know that racism, we know that sexual violence, we know that trauma can all increase your mental health conditions and your risk of suicide, especially LGBTQ identity status. So all of that to say is whatever identities you have, plus the things that are happening in real life. And anyone can see with the amount of people losing their jobs, with the unemployment rate, with what COVID has done, with all the back and forth with school, that there have been so many stressors that might exacerbate or worsen the day-to-day experiences of children who are not sure what's going on with their parents and their own mental health. And that uncertainty can lead to worsening depression. Hopelessness is one of the things we look for, especially when we're looking at suicide rates. Is there going to be any change? Is something going to get better? And I don't know that that's been clear to us in the past few years, that things are actually getting better.
Yeah, you mentioned all those stressors, right? I want you to, let's actually see if Andrea, if her audio is much better now. Andrea, I'll ask you this question. Talk about the trauma. Dr. Cyrus mentioned all the other stress factors, right? Homeschooling, things of that nature, your whole schedule being turned upside down. Talk about the trauma, right, of just growing up Black in America, on top of everything else you're dealing with right now with this pandemic.
Right. And so what that speaks to is chronic. So there's chronic anxiety, chronic depression Americans deal with every day. So there doesn't have to be this big insurmountable thing that occurs. No, this is chronic. It's walking in your neighborhood. We can't run in a neighborhood without being afraid that we're going to lose our lives, or play around, play at the playground. We could lose our lives, or even drive a car. So there's chronic anxiety and depression that we deal with. And from what we've seen in America, we're feeling like we are hopeless, like there is no hope, like there is no help. And that brings on paranoia that's chronic also. And the paranoia is paranoia that we actually see as rational. It's rational paranoia. And so what I want to say is that people think that suicide is an option, but it's not an option. It does not have to be an option, because they help out.
Dr. Cyrus, this is for you. Let's talk about our brothers, right? They have the highest increase in suicide attempts compared to any other race, increasing nearly 80% over the past 3 decades. Can you talk about how do we get our brothers to open up?
We have to start talking to our feelings, and we have to normalize it. We have to show that you are not weak if you are talking about having depression, or having thoughts of not wanting to be alive, or having panic attacks, or experience some trauma that's got you down and impacting your life day to day. I think it's a huge problem. We've typically thought about suicide as a thing in the white community, but we've known now for the past few years that it is a crisis in our own community, starting with Black men, Black boys, and Black girls as early as 10 years old. How often do we sit down and ask, maybe I'm talking to the baby boomers and the Gens Y and Xers, do we talk to the Gen Zers about how they actually feel? It is time to start asking how we feel and letting it be okay for our kids to tell them. the research that I have seen has shown that a lot of these kids, especially Black boys between the ages of 15 and 17 who are attempting suicide, are doing so impulsively. That doesn't mean that they've necessarily talked about having a mental health issue beforehand. It's just happened after some kind of crisis that happens at school or at home. And crisis can be a lot of different things. So my encouragement is for pastors, it's for barbers, it's for hairdressers, it's for baseball, football coaches, is to start asking these kids, what's going on at home? How did it make you feel? Do you need someone to talk to? Do you need some help? And normalizing that that is okay, because that's what we need to start doing before these kids don't have anyone to talk to and decide to do the last thing that they know how to do, which is to hurt themselves.
Yeah. We got to save our people. We have to. I thank you both for joining us. Such an important topic, and quite frankly, it needs more time. I look forward to continuing that conversation with you at another time. But to you at home, if you know someone who is struggling with depression or has had thoughts of harming themselves or even taking their life, here's the National Suicide Prevention Lifeline. It provides 24/7 free confidential support. That number on your screen, 1-800-273-8255. You can remember the last four numbers as TALK. Again, that number is 1-800-273